So what is there beyond patching? So apart from patching, atropine penalization, frosted glasses, there are newer modalities in amblyopia management beyond these traditional therapies. So amblyopia, the experimental studies have demonstrated the presence of binocular cortical communications um, even in amblyopes. So there is neural plasticity even in adults. So on this basis, binocular vision therapy aimed at stimulation of both the eyes than forced use of amblyopic eye alone. So what does binocular vision therapy gives? So in addition to visual acuity improvement, these methods are treating amblyopia through targeting interocular suppression, promoting binocular vision stimulation, improvement in BSV and stereopsis. So such therapies involve all visual tasks vary from simple games using red-green glasses and simple video games, virtual reality games, and so on. So these are the platforms available in binocular vision therapies, perceptual learning, dichoptic therapy, iPod therapy, head-mounted virtual reality therapy, and balanced binocular viewing therapy and magnocellular stimulation. So perceptual learning. So this depends based on practice makes perfect. So it involves practicing recognition of the repeated visual stimuli. These stimuli may be in the form of vernier acuity or Gabor detection. So it facilitates neural connections at the cortical level through a computerized visual training regimen using Gabor patches. So there is no financial interest. So revital vision is one of the method using perceptual learning technique, since it is a non-invasive and patient-specific perceptual learning program based on vision stimulation. So what are the benefits? So improved visual acuity, they have seen enhanced contrast sensitivity, improved depth perception, and long-term efficacy. So many studies have been proved to be, it is very effective in case of amblyopia. So this was a study done by Magnan et al. Improvement was observed in 83% of the participants with significant results for both unilateral and bilateral amblyopia. Age did not significantly affect visual acuity improvement, and it was also sustained over 5 years follow-up period. So it's time to start our gameplay. So what is dichoptic stimulation? So it is also a promising therapeutic approach to amblyopia. So in dichoptic training, where we present independent stimuli to each eye simultaneously, and integration of these two stimuli under binocular viewing condition. So the contrast or quality of the image which is presented to the amblyopic eye will be higher than the non-amblyopic eye. So again, binocs is one of the strategy. Here the patient needs to be equipped with computer, with uninterrupted internet connection and anaglyph glasses. So it is done either in the hospital-based or office-based exercise or home-based therapy. So again, there is improvement in visual acuity, enhanced contrast sensitivity, better stereopsis, and eliminates interocular separation. So here you can see a child is playing a super car game.
So that
With
she is trying to
red-green
catch that
glasses on.
petrol bulk. Petrol
She's
bulk.
actually trying to use her amblyoptic eye to see the target. So as you can see here, the contrast will be higher in amblyoptic eye than the non-amblyoptic eye. So again, recently published article by Sandra et al., effectiveness of dichoptic therapy for treating mild to moderate amblyopia. So they have the most common etiology they have included is anisometropic amblyopia. It is very effective in anisometropic amblyopia, followed by emmetropic amblyopia. So these are the results. So out of 73, 73 patients included, 61 patients improved in visual acuity, 21 patients improved in binocular vision and 46 patients improved in stereopsis. So even patient having 6/6 in both the eyes, but patient will be having a low grade of stereopsis, we can actually advise them to undergo binox therapy. So these are the advantages. There is a visual acuity improvement, binocularity, stereo acuity. So even in older age group, so in this study, they have included age ranges 5 to 25 years. So older than 8 years also we can give. Also 5 to 6 months follow period, even they have seen long-term effectiveness. So another therapy is dichoptic therapy with virtual reality. So it's a fully immersive 3D experience tool. It is a well modernized vision therapy. So it is actually well adopted by children, interactive and adaptive tool to younger children. So which improve compliance. So tool that will be very useful and appealing for younger children. So components are head-mounted display with a pre-installed training app and handheld controller and a tablet with a parental control. So recently they have started giving head-mount displays to their home as well. So previously we were able to do it only in the office-based exercise. Now we currently they have giving home-based therapy as well. So these are the different levels of games. 7 different games are available at different levels. So one main advantage in BV therapy, we can actually add virtual prisms. Minimal angle of strabismus also we can give. So in binox, we should have a patient orthophoric. So in non-strabismus cases, only we can give binox. In BV therapy, we can actually add virtual prisms for a minimal angle of exotropia and esotropia. So it can be given monocular therapy with a cyber patch filter. So it improves saccades, pursuits, eye-hand coordination, and vergence. So here is a child uses head to hit the snowball with the small square as a bat. So we can change the background color, contrast, and transparency of the snowball as well. So these are the evidences, so which are very effective in adults too. So our experience, out of 132, 42 patients improved in visual acuity. So 26 improved in binocular vision and 25 patients improved in stereopsis. So long-term follow-up is needed. So this is quite recently getting famous by Santan Gopal sir, Orthoptech. So it is Santan Gopal sir has actually studied the effectiveness of OMS as a treatment for amblyopia and strabismus. So this device is based on the principle that repeated stimulation of magnocellular cells in the peripheral retina during saccadic movements causes stimulation of V1 area of the occipital cortex via top-down impulses, which eventually improves the visual acuity. So in Aravind Hospital, Tirunelveli, Fatima Madam has experienced orthoptech. So 48 patients completed 10 sessions. This is a small pilot study done in IIH Tirunelveli. So mean age is 10 years. From age range is between 5 to 23 years. So these are the improvements that were seen here. So out of this, mostly anisometropic amblyopia and strabismic amblyopia. In intermittent XT patients also, we could see a reduction of exotropia, the amount of deviation. So in 10 intermittent XT patients, 6 patients showed stereopsis improvement. There was a good control in intermittent XT. So OMS was equally effective in both strabismic and anisometropic amblyopia. So minimal cutoff we can take is 6/12 vision. So maximum we can take patients with 6/60 as well. So OMS stimulates the attention area, which stimulates the V1 area of the occipital cortex. So all the features, BSV, stereopsis, and visual acuity showed improvement after OMS therapy. So even in deprivational amblyopia, strabismic amblyopia, Sir has published a pilot study of 35 patients with 85 to 90% improvement in patients. So pharmacotherapy. So PEDIC studies have evaluated the role of levodopa in amblyopia. So despite initial improvement, there was a partial regression after treatment. So carbidopa, levodopa, citicoline also is, many studies have been published, inhibits apoptosis in neurogenerative models, thereby protecting neuroplasticity. So another fluoxetine, a selective serotonin inhibitor, a reuptake inhibitor used commonly as an antidepressant, is now being tried in the treatment of amblyopia. So literally there are so many therapies available for amblyopia, starting from atropine patching. So many are there. So planning on to the management part. So we have to decide, it is important to note the grade of amblyopia and type and age of the patient. So primarily proper and careful refraction has to be done. Patching, as soon as the diagnosis is made, patching has to be started as early as possible. So most importantly, socioeconomic status should be taken into account before starting any expensive therapies. All these computerized therapies are a little expensive. So meticulous follow-up is also needed. So as Jitani sir mentioned, we can actually plan for a shared medical appointment. So where we can pool our amblyopia patients and we can encourage them to have a discussion about their challenges of doing patching, of doing home-based exercises. And we can also give active vision therapy exercises in our OPD clinics by like painting, drawing, clay modeling, etc. So conclusion, if not a replacement, these treatments which are still evolving can be a good adjunct to the existing traditional therapies. So patching is the gold standard, easy to understand, economical. So compliance part we have to think. So vision therapy, even though we have a good compliance with all gaming things, but still expensive. So thank you.